Okay, we're going to have a conversation that probably a lot of you are going to be very interested in, but you might not quite know who you can talk to about it. So we have brought her to you. Her name is Lauren Barlew. She is a women's health nurse practitioner, born and raised right here in Chattanooga on Signal, a Vanderbilt grad, and back home to have her practice for 10 years. You've been doing this.
Yes.
With Lotus Center for Women.
That's right.
And what I'm going to kind of set you up, because you know the truth of the matter is, Lauren, is you and I are going to have this conversation. It can feel in public a little awkward, and it shouldn't. That's part of the reason you wanted to come on.
That's right.
But women, especially when they hit a certain age, over 50, menopause is a real, it impacts your life.
Yes, absolutely.
And sometimes it can impact your life in your most intimate ways, and that's where you are there to help people.
That's right.
How's that for a setup for you?
That's right. That sounds great. Women's sexual dysfunction affects about 43% of women in the United States throughout their lifespan, and a large portion of my patients will be premenopausal or menopausal, that they're having negative impacts on their quality of life. But menopause is not just hot flashes and night sweats. It's also, it has a very negative impact on intimacy with partners, and there are a lot of ways that we can address that to make that part of their life more enjoyable.
I would think, when you live with something daily, I don't care if it's allergy season in town, you don't necessarily realize how much it's impacting you because it's gradually happening to you.
That's right.
With the whole over 50 thing, menopause in and of itself is a big deal because there's just kind of this loss of who you have always been as a woman. It's more of a mental toll than people realize.
Right.
You throw this component into it, and a lot of women keep quiet.
Right, they do keep quiet, and even in like general OBGYN practice, some of them are very embarrassed to bring it up, or they kind of tiptoe around the conversation. So I've always worked to bring that out in them, and some of them are a little bit more interested in talking about it than others. But I just want to make sure that I give them the opportunity to speak up if they have any concerns. And often I do find that they are having issues with their desire or interest, or they're frustrated by their relationship, from their intimate relationship, and it can really have a negative impact on them.
Okay, so I'll tap dance around a few things and tell me if these are questions that
sure.
you commonly hear.
Sure.
So first of all, you had said something to me before we went on camera about hormone replacement therapy.
Right.
So do people sometimes, because some women don't want that.
Right.
Some women very much do.
Right.
So is your approach to try to make your body and your life evolve in as non-medical of a way, medicinal of a way as possible?
Yeah, I try to approach, there are women that are seeking hormone replacement therapy, and there are also, of course, those that are seeking non-hormonal options, and there's definitely plenty of options for both sides.
Okay.
Oftentimes I'm combining some FDA-approved medications for hypoactive sexual desire disorder with some hormonal hormone replacement, like testosterone replacement, for example, or general, like you hear more commonly, estrogen and progesterone. But then for those ladies who prefer not to go the hormonal route, there's certainly other routes that we can go.
Okay, and are you sort of uniquely schooled in those approaches, those non-medicinal approaches?
Yeah, so my background is an adult primary care nurse practitioner as well as women's health, so I have a lot of experience in managing, for example, we use a lot of antidepressants, or there are also, strangely enough, blood pressure medications or other things that we can use to manage hot flashes and night sweats, and we can also get added benefit from those for mood changes during that time of life too.
Well, I think I was talking to a friend on the phone the other day. I have two daughters. One's getting married, one's graduating high school, so I'm a hot mess, right? And I was talking to this friend, and she said, well, Julie, how would you define your emotions? And I really couldn't answer her, but I said, I think I feel kind of disconnected. Like I don't know kind of who I am anymore. And I think maybe some of that is your 50s and over time in your life too. So when you talk about these things that happen, you no longer are the you used to recognize.
Right.
Do you see where I'm going?
Yeah, absolutely. I am. It's very upsetting to me that on a daily basis, talking to ladies who they are going through this change in their life and they're having such negative impacts on their personal lives, their job performance, their relationships with others because of hormonal changes that are occurring to them. A lot of ladies will complain of brain fog and they just can't complete tasks like they used to. They have to make lists for everything, and that's very real, and
so
we can address that.
When we show people how to find you, and your office, you kind of share the building, right? With the pelvic floor specialist on one side and
So the building is on Holtzclaw Avenue across from the zoo. They've done a lot of renovations to it. It'll be very nice. And I'm sharing the space with a pelvic floor physical therapist to help. So I'll be managing the medical side of things, and then she'll be taking the more musculoskeletal component of that. And so we'll work together to get ladies back.
So do people ever come into your office and they come because they maybe want to talk to you about hormone replacement therapy and their options? That's kind of a safe way in, so to speak. And then from that relationship, they begin to say, now that I'm thinking about it, there's this happening with me over here.
Right. So a common conversation is that they will talk about their hot flashes, the night sweats, and then I usually will prompt them to see if there's any other concerns that they have. I always ask if they have any sexual health concerns or if they're experiencing vaginal dryness, which is a very common complaint, and that kind of gets rolling into that conversation a little bit deeper.
Do they ever get emotional with it because they didn't know they could talk about it before?
Yeah, absolutely. Yeah. I think a lot of people are nervous as to what the reaction will be when they bring it up, but I feel that I make people feel comfortable and that they can open up to me.
I had asked you if there was anything you wanted to make sure we did focus on, and you said you would kind of like people to know what your setup is like compared to a traditional OBGYN office. So does it feel different when you first even come in?
Right, so the feel we're going for is it feels like a home, so it's not a sterile medical environment. I'm hoping that it makes people feel welcome.
Yeah.
I'm also hoping that by having a designated physical location that you are coming to talk about your intimacy and issues with that, then that breaks down a barrier to patients so that they come in the door, they know that that's what they're going to be talking about, and we can be a lot more efficient with our treatment plan.
I'm guessing that it's a case-by-case basis how long a woman comes to see you.
Yes, absolutely. So there will be some ladies that we can make some adjustments to. Maybe there's common medications that cause some issues with libido and such things. So making adjustments to those or adding on some therapies to that, and we may see them a handful of times. Then there are other ladies, for example, different hormone replacement regimens, we may see them every 3 months.
Right.
So there's a wide variation there.
Well, if our hormones weren't so important, we wouldn't be giving them to begin with, right? So of course you want to hold on to them and make them give you your most optimal life.
Right.
Does it all begin? Should people, do you think, just call you, or is it helpful if they go on your website? Because you've got a laundry list of services.
Yeah. I think that the best way for them to understand exactly what I'm diving into, it would be to go to the website, lotuscenterforwomen.com. And on there's a list of diagnoses that I'm treating. And also you can book online, which I think will be really nice for people who don't want to make that phone call. They may feel embarrassed or something. So they can book online, or they could also call the office. We'll be happy to help them.
Thank you for the conversation.
Yeah, absolutely. Yeah, thank you.